one form of arthritis at the same time. Is that possible? So arthritis is the most common symptomatic chronic disease around. There are over 100 different forms of arthritis, rheumatic disease, and they range to very common of around 15-16% of the population to well under 1%. But given that there are over 100 different forms with various prevalence of how common they are, statistically, it has to be possible to have more than one type of arthritis. For the most part, though, that's very uncommon, especially the types of arthritis that are not very common on their own. There are probably two situations where we see this more commonly, and we'll talk about those today. So arthritis and fibromyalgia are often seen together. In fact, there's data to suggest upwards of 1/3 of individuals who have arthritis, particularly inflammatory arthritis, such as rheumatoid arthritis, may also have fibromyalgia. Now, arthritis is a joint disease, causes pain, stiffness, and so forth. And we review different forms of arthritis in other videos on our website as well. Whereas fibromyalgia, while certainly it is felt in the joints, it is much more diffuse than that. It is felt everywhere. Individuals describe essentially head-to-toe pain, maybe worse in certain areas, but really that they feel it everywhere. That pain, stiffness, and fatigue is really a big role here as well. Not to say that it isn't in arthritis, but non-restorative sleep, really we see quite a bit with fibromyalgia. So even if you have a good night's sleep, you don't feel rested for that day. Those conditions we will see relatively common, like I said, about 1/3 of the time together. The other situation that we can sometimes see together is a combination of inflammatory arthritis and osteoarthritis. Now, inflammatory arthritis, the most common form is rheumatoid arthritis, but there's a whole host of others, including psoriatic arthritis, reactive arthritis, enteropathic arthritis, meaning arthritis associated with Crohn's or colitis, ankylosing spondylitis, and so forth. These are autoimmune diseases, meaning the immune system decides to attack the joints and causes the symptoms that we feel. Most of these can really involve joints head to toe. Some folks will have only 1, 2, 3, whereas others can have 20, 25, 30 joints involved. And inflammatory arthritis is not only a joint disease, while that's where we feel the symptoms the most, it really is a systemic condition. Osteoarthritis is the type of arthritis that most of us use the term quote-unquote arthritis for day to day. But osteoarthritis is that wear and tear arthritis that we all get as we get older. Certainly osteoarthritis is more complicated than just wear and tear, but that's often how we think about it. And when we say we get older, really we're talking about 30 and above. Some of us feel it more, some of us have it more, in combinations of that. There are more common spots to have osteoarthritis. Certainly this is not an exhaustive list, so you can get osteoarthritis in other joints beyond this. But the joints at the ends of the fingers, the joint at the base of the thumb, and the hips and knees are probably the most common areas of getting osteoarthritis. And certainly it's possible to have both inflammatory arthritis and osteoarthritis. One doesn't prevent the other from happening, but they really are two independent processes, two independent diseases, two independent conditions if they do happen to a given person. Now, if you do have inflammatory arthritis and osteoarthritis, or if you do have arthritis and fibromyalgia, what do we do to treat that? Well, I think there's some key principles here. So it's really important to work with your rheumatology team to ensure we all can differentiate which condition is causing which symptoms. It's important for your healthcare team to know, and it's important for you to know. And sometimes that can be really tough to tell. And it takes a lot of conversation and physical exam, and sometimes some tests, to ensure that we know that certain symptoms are due to which form of rheumatic disease. And that's really important because we want to treat each of those in the right way. We don't want to overtreat one condition with any of the potential risks of more medications and that sort of thing without any benefit. But we also do not want to undertreat where a given condition continues to cause you symptoms, pain, stiffness, and so forth, because we're not addressing that properly either. Sometimes it's not straightforward, but it's really important that we continue to work together to achieve that goal of treating both as best as we can. Once we're able to differentiate each condition, we treat as we normally would. So the treatments, say for rheumatoid arthritis, do not change if we have fibromyalgia or if we have osteoarthritis, and similarly for fibromyalgia or osteoarthritis as well. Certainly if we're undertreating one, it can impact how we feel about the other one, depending on how well it's controlled. So we really do need to look at things in totality. We never want to just treat the disease, treat the condition, but really important to help the person in front of us to ensure the goals that they want to reach are achievable, reachable, and that we do a good job of getting there. For more information on any of these forms of arthritis, feel free to watch any of our other videos or visit us at our website at albertarheumatology.com.